Should I share the presentation, or Madeline, will you be doing that? Ah, there we are. Okay.
She's done it.
Okay, so thank you. I'll already just start introducing myself. So I'm Caroline Green. I'm a postdoctoral fellow at the ARC South London Social Care Theme. And later you'll be meeting Rachel, who will be introducing herself, but who I've had the pleasure to work with on a project which is very different to what we just heard. And I want to start by saying that I'm really grateful that we can be part of this learning group. And you will see that this project is something where me, as a white, middle-class, middle-aged, very privileged woman, is sharing something that for me is a very humbling and also a vulnerable experience. And me as a researcher, I've done a lot of work around human rights in care homes for older people. I've read around PPI about good practice and so on, but actually doing it and really, trying to put a project together that is truly, about involvement and hearing different voices is difficult. And we will be sharing some very practical learnings with you a little bit later on. We're quite critical of ourselves and want to do better. So we are going to, be sharing something that's quite vulnerable with us for us, but we feel safe in this group to do that. So yes, we'll be talking to you about a collaborative arts-based project. Now, this is not a research project as such. It is really a stage before a research project. Next slide, please. So what is this project? It came about, really the idea came about last October in something called the Power and Rights subgroup. And that is a subgroup of the Social Care Innovators Network based in the Institute of Health and Social Care Management. And those social care innovators are different people who are interested in working and studying social care. And we all came together in a big group and formed little subgroups, and the Power and Rights subgroup is chaired by myself and Mervyn Eastman, who can't be here today, unfortunately. And there we had the idea to come up with a film, an arts-based film project to hear about human rights and social care, and whether we need a human right to social care. So that is, the idea is really linked to developments on the international level, on the level of the United Nations, where we have a lot of talk around a possible convention on the rights of older people currently. And as a group, we discussed that there is a human right to health, but there's no right to social care. And in the current climate that we're living in, we thought we need to explore whether we also need a human right to social care. Next slide, please. So our idea was to not just stay in our little group of people who are very passionate about social care, but we really wanted to go out, and we wanted to hear different perspectives from people who draw on social care and people who work on social care and academics and so on, whether they think that we need a human right to social care. So we said, okay, we don't want to, in order so that we can get different perspectives, we're not going to have a preset agenda of what we think is right or wrong. So whether we think that we need a human right to social care or not. And we also didn't have a definition of social care. So we really wanted to, go out there and just see what people think about this question. So we wanted to use artistically capture the essence of what people say to us, and we then want to produce a little film later on, which we want to aim at policymakers. So in a way, it is a research project, but it's very much involving people in the public. So the project has two phases. We're currently halfway through phase one. And phase one is the research and development phase, where we're still collecting these different perspectives out there. And the second phase will actually then be the filmmaking with different people and then disseminating that film. So I'll be just telling you a little bit more of what we have done within phase one up to now. Next slide, please. So phase one, research and development, as a group, Rachel, Mervyn and I, and we always fed back to that Power and Rights group, we had all these questions. We had the idea, but we didn't really know how to start. So we wanted to, of course, ask ourselves, what do we want to achieve? What artist are we going to use? How are we going to involve them? What does the R&D phase look like? So the research and development phase, how will we all set it up? Where's the funding going to come from, and so on. So for research and development, we said, okay, we need to find different ways of engaging people. So a first phase of research and development included online workshops where we invited people to see us, and have a workshop with us where we try and answer these questions around, do we need a human right to social care? And at the end of the month, so on the 31st of March, we will have a face-to-face tea dance event at Stansted Lodge Seniors Club, which is in Catford, London. We then, also had to, of course, ask these questions: how to participate, how are we going to get people to participate in the workshops, and so on. What I'm trying to show you with all these questions is that it was really difficult for us to start the project, like any project really, whether it's a really academic research project, or whether it's a grassroots, ground up involvement project, what we are trying to achieve here. Next slide, please. So until now, what we have done, we have had 5 online workshops, and we decided that these workshops should be really short. We had them 30 minutes each, and they were led by a theatre artist called Christopher Green, who themselves is all about social care. So their work is around linking art, theatre, and with social care. So we found Christopher to work with us, and it's been really great. And Rachel will be going into more detail of what we learned from these 5 online workshops in terms of involving people. And then, as I just mentioned, at the end of this month, we will have a tea dance. What I mean by that is it's literally going to be dance and tea at a lovely venue in Catford, London, where we're going to, again, be exploring with the people who will come this idea around a human right to social care. The funding for these 2 phases in the research and development came from ARC South London Involvement Fund. So we're really grateful for that. And what we're using the money for are vouchers for our participants. We want to support people to actually, be transported to Stansted Lodge Seniors Club with internet costs, phone costs, and so on, so that everyone can participate in these workshops. So it's something we really needed to think about too. What can we use the money for? But as you will see in a minute, the research and development is much more than the workshops and the tea dance. It's a lot of conversations that are following at the moment. And this is where I'm going to hand over. Next slide, please. I'm going to hand over now to Rachel, who will be talking to you about the real practical learnings from organizing and running these 5 online workshops, and the conversations we have had afterwards. So Rachel, over to you.
Thank you. Okay, good afternoon, everyone. Thank you very much for the brilliant introduction, Caroline. Yes, I think, Caroline, fair to say that we've been quite harsh on ourselves in terms of the critique on our learning. Could we have the next slide, please? So our first learning is that we felt we should have promoted the events in in multiple channels. We use primarily Eventbrite and Twitter, Facebook and LinkedIn, which reached out to a wide number of people, but we also recognise that didn't reach out to a lot of people who may not be able to access digitally, or maybe not within our network. So a lot of the people we had on our workshops did involve people we knew about, and we wanted to expand further. So that's our first learning, that don't rely just on social media and just on the 3 of us to promote the event. The next learning is on number 2, which is about reaching out wider beyond our network. And we are addressing that at the moment by actually ringing and running a number of face-to-face meetings. So for example, I'm based in York. I've been working with a group with learning disabilities, self-advocacy group, and also homeless services. These were hard to reach online, but face-to-face is more manageable and is having a valuable conversation. And Caroline and Mervyn are similarly having conversations with people now, people we miss. The tea dance will also provide us an opportunity to meet diverse people who are familiar with the venue in Catford and to talk to them face-to-face. And this will also enable us to reach out to those who may not economically be able to access digitally. Next slide, please. So online does suit a lot of people, including people with disabilities. I am myself profoundly deaf, and I find actually online can be really, really helpful with captions and transcript, but it doesn't suit everyone. And we need to recognize that and not make assumptions about access online. We deliberately made the session 30 minutes. And this was actually a good move because it fitted in with most people. Busy lifestyle, but also in terms of concentration, access, it made it easier for most people. The downside was that we had the Eventbrite registration was 50%, so our group size was much smaller than we expected, and it's a learning for next time. Our 2 questions worked well. We had some really, really good discussions from the 30 minutes. Each group that we had was very, very different from the previous one, and each were equally valuable in terms of the feedback we got from the participants. So I felt that bit we got right. But having said that, most of the people who participated were professionals with a small number of people who use social care. So that was the bit that we missed out. And as I said, we're addressing now on the face-to-face and follow-up phone calls. Next slide, please. We are also very mindful that we missed on ethnic minorities. We believe we may have had blind spots, unconscious bias, so perhaps could have benefited from having someone else onto our managing group. There may have been language barriers, cultural barriers, religious holidays that we weren't aware of, and it's something that we will certainly work on and would like feedback and help on that. We've also realised we missed out some carers, and now carers have been through an incredibly challenging time through COVID, and I think there is heightened sensitivity. So there is a real need to build relationships of trust, which have taken longer because they've had to fight for everything they needed during COVID time. And I think we do need to work through that. And we also need to be able to make our material more accessible. So for example, a lot of our material is too abstract. And I'm working with visual aids next week and also short sentences, which would also be useful for people living with dementia. And it's something perhaps we should have done earlier on in terms of promoting our event, putting our information in accessible format before inviting. Next slide, please. Arts and artists can bring people together with different backgrounds, and this has been very successful. Christopher Green has been really good in leading the workshop. He has actually brought a very abstract concept, human rights, by getting people to share their stories, and this has worked. I'm looking forward to seeing more of this in the following workshops in Stansted, and I would like Caroline to share on this one, on the other benefits we have learned through the artists and art.
Thank you, Rachel. I think that, yes, I think that art can bring different people together because it is a bridge between cultures and languages and so on, a different way to communicate with each other. And so we're really excited to see what will happen at the end of the month during our tea dance, which will again be led by Christopher Green. And yeah, I mean, what I think a specific learning I'm hoping that I can also get from the rest of the group is how to really also involve people with cognitive impairment. We feel that there's quite often, and that very understandably, perhaps a barrier between people who care for people with dementia or learning disabilities, and maybe they are spoken on behalf of, but it's very difficult to actually really reach people themselves and make sure that their voices are also heard. And perhaps we need different ways of communication to make abstract topics less abstract and more graspable So if there are any learnings around that, I'd really appreciate to hear that. But yeah, so thank you very much for listening to us.